Bumps and bruises are the most common types of injury, and in most cases, they require the least amount of first aid. Shocks comes from the common household items and outlets. Bumps and bruises are types of damage that occur in the soft tissue under the skin. There is no need to call for medical assistance when a person suffers a cut, scrape, bump, or bruise if the injury is more or less than 1/2 inch around. There is no bleeding or only slight bleeding. The victim does not feel the numbness and tingling. The person is not suffering from any paralysis. First aid for cuts and scrapes. If the injury area has a skin scrape, wash it with mild soap and lukewarm water. Apply antibacterial cream or spray to prevent infection. Cover the wound with a sterile gauze pad and tape or a simple band-aid. Steps for treating bruises. Immediately apply an ice pack on the bruise to reduce swelling. If possible, elevate the bruise area so that it is higher than the heart to prevent blood pooling in the affected area. Seek prompt medical help if there is any swelling around the bruise. This can signal danger to nerves, muscle, and bones.
First-degree burn involves only the outer layer of the skin. The skin is dry, painful, and sensitive to touch. A second-degree burn involves several layers of the skin. The skin becomes swollen, lumpy, whippy, or blistered. Degree burn involves all layers of the skin and any underlying tissues or organ. The skin is dry, pale, white, or charred black, sometimes swollen, and it breaks off. Here are some preventions to avoid burn. 1. Install smoke detectors in your home. Keep a fire extinguisher near the kitchen. Set your water heater at 120 degrees or lower to avoid burn, and do not smoke in bed. If your clothing catches fire, do not run. Just stop, drop, and roll on the ground to smoother the flames. Smoother the flames with a blanket. Use water to douse the fire and cool the skin.
Animal bites. When bitten by an animal, most people want to know if they need a rabies shot. The main wild animal carriers of rabies are bats, mice, and foxes, and etc. Pet dogs and cats that have even vaccinated rarely have rabies. Home treatment. Step 1. Wash the wound thoroughly with soap in flowing water. Step 2. Wash the hands also well after cleaning the wound to avoid the infection. Step 3. Treat the punctured wound with betadine. Step 4. Visit to the nearest clinic in your municipality. Dealing with electric shock. Electricity causes burns via the flow of electric voltage through the skin, but electric shock can cause more than burns. It can cause tissue damage, and extremely high voltages may even stop heartbeat. These are the steps in handling emergencies and treating for electric shock before help arrives. Step 1. Turn off all the power. Don't waste to switch off or remove plugs immediately. These are the things you can do to help without injuring yourself. Step 2. Check the injured person's ABC: airway, breathing, and circulation. Step 3. Apply cold compresses to the burns. Step 4. Keep the injured person on his or her back without his or her feet and legs elevated. Step 5. Gently cover the injured person with a blanket.